Miconazole-3 200 mg to 2%, 9 gram, Vaginal Kit is used to treat vaginal yeast infections. It helps reduce vaginal burning, itching, and discharge that may occur with this condition. This medication is an azole antifungal that works by stopping the growth of yeast that causes the infection. The vaginal product comes in two forms, a vaginal cream or tablet, and some products also come with a skin cream to be applied to the area around the outside of the vagina. It's important to ask your doctor before using this medication for self-treatment if this is your first vaginal infection, as it only works for vaginal fungal infections. If you have fever, chills, flu-like symptoms, stomach/abdominal pain, or a bad-smelling vaginal discharge, it's important not to use this medication and to contact your doctor right away, as these may be signs of a more serious infection. Before using Miconazole-3 200 mg to 2%, 9 gram, Vaginal Kit, make sure to read all the directions on the product package. If you have any questions, consult your pharmacist or doctor. This product is for vaginal use only. Wash your hands before and after use and avoid contact with your eyes. The dosage is based on your medical condition and should be used usually once daily at bedtime for 1 to 7 nights, as directed by your doctor. If you have itching/burning around the outside of the vagina, apply the skin cream to that area. It's important to continue using this medication every day for the full time prescribed, even if symptoms disappear. Do not use tampons, douches, spermicides or other vaginal products while using this medication. If your condition does not improve after 3 days or lasts more than 7 days, or if your infection returns within 2 months, consult your doctor. If you experience headache, vaginal/urethral burning/itching/pain, or lower abdominal cramps, notify your doctor or pharmacist promptly. Your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare, but seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects not listed. Before using Miconazole-3 200 mg to 2%, 9 gram, Vaginal Kit, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other azole antifungal agents. This product may contain inactive ingredients that can cause allergic reactions. If you have diabetes, immune system problems, or frequent vaginal yeast infections, it's important to consult your doctor or pharmacist before using this medication. Additionally, before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are using this product, it's important to ask your doctor about whether you can have sexual intercourse. This product may weaken rubber products, such as latex condoms, diaphragms, and cervical caps, leading to failure and potential pregnancy. During treatment with this medication and for 3 days after treatment is over, it's important to use other forms of barrier protection/birth control, such as polyurethane condoms. If you are pregnant, do not use this medication for self-treatment. During pregnancy, this medication should only be used when clearly needed, and you should follow your doctor's instructions on how to use the applicator to insert this medication. It's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Miconazole-3 200 mg to 2%, 9 gram, Vaginal Kit, it's important to be aware of potential drug interactions. These interactions could affect how your medications work and increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Make sure not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with this drug is warfarin. It's essential to be cautious and consult with your healthcare provider if you are taking this medication. If this medication is swallowed, it can be harmful. If an overdose occurs and serious symptoms such as passing out or difficulty breathing are present, it is important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It's important not to share this medication with others. To help prevent vaginal yeast infections, make sure to dry the genital area thoroughly after showering, bathing, or swimming. It's also recommended to avoid wearing tight jeans, nylon underwear, pantyhose, a wet bathing suit, or damp/sweaty exercise clothes for long periods. Instead, opt for cotton underwear and make sure to change it daily. If your sexual partner experiences symptoms, they should contact their doctor right away. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember to store this medication at room temperature and ensure it's kept out of reach of children and pets. Do not flush it down the toilet or pour it into the drain unless specifically instructed. When it's expired or no longer needed, be sure to properly dispose of the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.